Today, the director of the CDC is in Houston. Another stop on her tour across the country, meeting leaders and taking fall and winter viruses and how we're dealing with it. So we're going to be talking about that.
Yeah, and this morning, Dr. Mandy Cohen joins us live in the studio with how you can stay safe and healthy this holiday season. Thanks so much for taking the time to speak with us.
So great to be here.
Yeah, you know, you took over the CDC director role in July. What changes, if any, have been made and what's being done under your leadership?
So look, we learned a lot through really historic time here, and I'm really proud of the CDC for taking those lessons and moving forward, whether it's everything related to building trust, being transparent, communicating more quickly. That's why I'm here this morning to talk about how folks can protect themselves going into the fall and winter. We know we're going to be traveling with Thanksgiving, so we want folks to get vaccinated, get protected, and then make sure you're doing everything we can to protect each other.
It's such a high profile and I'm sure very strenuous job. How did you do the passing of the guard, so to speak? Did Dr. Walensky work with you and just give you ideas of what worked and perhaps what didn't work for her?
Sure, of course. She's been a great support, so I could learn, from her, and certainly from many who have been thinking about how we need to learn lessons from the pandemic and move the CDC and public health forward. I think we've seen how important it is for us to have a strong system that protects health. We all want to be healthy. We want to have a great holiday season, and so there are ways for us to do that. And so I've been learning from a lot and sharing what I know around the country.
Right, yeah, you're in Houston today, but like you mentioned, this is a part of a larger tour across the country. What have you been doing?
Yeah, I've been thanking folks who are working on vaccines and giving out vaccines, particularly those who are working with folks over 65, so our seniors. So I've been to a number of nursing homes and senior living centers because those who are over 65 are at the highest risk of getting really sick from flu and COVID and RSV. But the good news is we have tools, we have vaccines that folks can use to protect themselves. So I want them to know what I would do, not just as CDC director, but for my own family. And my parents have gotten vaccinated. I've gotten the updated COVID and flu vaccine, and I have two daughters who are 9 and 11. They are both vaccinated with the updated COVID vaccine and the flu shot. So I just want folks to have a happy and healthy holiday season.
Yeah, and I think that you seem like a very calming soul. So do you feel like that you're sort of nurturing people to make them feel more comfortable about it? Because there is vaccine fatigue going on right now for sure.
Yeah, I know folks have gone through so much. We all have in the last few years. And I want them to know that we have the tools to protect each other. Sure, we've been talking about vaccines, but don't forget, you want to also get tested. You want to know what you have if you get sick, because we have treatment, and treatment could save your life. So you want to know, do I have flu? Do I have COVID? Or is it something else? So you can get the treatment you need. It could keep you out of the hospital and potentially save your life.
Okay, and let's talk about this new COVID variant. There's apparently an added symptom called COVID tongue. What have you been seeing?
Well, so COVID is still changing as a virus, and we want folks to know that as it changes, that's why we're recommending this updated vaccine. You want to have the updated protection to match how this virus has changed. So similar to, I know some of us get the flu shot every year. It's because the flu changes every year and COVID is changing as well. So you want that updated flu shot, and it's important to know that some folks are getting extended symptoms from COVID, long COVID, and if you get vaccinated, it can reduce your risk of long COVID. And long COVID can happen even if you have a mild case of COVID, and no one wants that.
And all ages, it can really be devastating. I've seen that so much of that in our viewers. Let's talk about what's going on with the vaccine and how you change it. So you just signed off on a new one in September. How important is it to keep tweaking that as this thing morphs, so to speak?
Yeah, that's exactly right. So it does keep changing, this virus, and so the reason you want to get vaccinated, again, 3 reasons. The virus has changed and you want the most up-to-date protection for the latest virus. Second, if you've had COVID before or you've been vaccinated before, that protection decreases over time. So you want to get boosted back up. And the third reason is what we were talking about, long COVID. No one wants to be sick for a long period of time. So getting vaccinated can reduce your risk of that. So get out and get yourself protected. Like I said, got myself vaccinated, my kids vaccinated. We want to all have happy holidays.
Yeah, when it comes to the boosters, there were different vaccines out there, and some may be wondering, well, does it matter which one that I get? Is one better than the other? What do you say to them?
I'd say I have no preference for any of the brands to just go out there and get vaccinated. That's the most important thing, because there's a lot to do. Protect ourselves from COVID and flu. And remember, we have new vaccines against RSV. Actually, in Texas right now, we're seeing a lot of RSV in our kids and more babies in the hospital with RSV. And for the first time, we have a shot, an antibody shot that we can give babies. So we want folks to call their pediatrician and talk to them about that new antibody shot.
Okay, so let's talk about making sure seniors are safe. You keep mentioning them over and over, making sure they get all the different types of vaccines. How important is it that they space those out? Because we have seen some medical literature that shows there could be a risk of stroke if they do them at the same time. What is your best advice to seniors?
So it is still a best practice. You can get them on the same day, but for seniors, again, there's I would talk to your doctor, right? Always talk to your doctor about what might make sense for you as an individual. Still okay to get them on the same day. We were seeing a signal. Again, that's not something that's changing our guidance yet, but it's showing you that we are monitoring what is going on constantly. And if there's any change, we will come back and tell you about it. But right now, talk to your doctor. You can get your COVID and flu on the same day. But if you want to space it out, also fine as well.
Okay, all right, lots of great info. Thank you so much. Again, Dr. Mandy Cohen, the director of the CDC, here with us this morning.
Safe travels across the country. Thanks for taking time in Houston.